Is it recording? Okay. My name is Pilar. I'm a nurse educator student in the advanced physical assessment class. This is my final head to toe assessment video. First, I'm just going to show you my hair's pulled back, my ears. There's no headphones or anything in my ears. I'm going to have my cameraman scan the room so that you can see there's nothing on the walls. Okay, and we will get started. So I want to introduce myself to the patient, perform hand hygiene, put on gloves if necessary. So hi Chuck, my name's Pilar. Is it okay if I perform a head-to-toe assessment on you today?
Yep.
Okay. And then I would start with a general survey of the patient. So just looking at him, he appears well dressed for today's exam. I noted his vitals before I came in the room. They were all within normal limits. His BMI is 26, so that is normal as well. His posture is good. He has no obvious odors. Like I said, he is dressed appropriately. Next, I would start with an inspection of his skin. So can you raise your shirt up for me on both sides? And then your legs, pull up your pants as well. And for the sake of this exam, I'm just going to do a unilateral assessment on everything unless I know otherwise for the sake of time. So I would inspect his skin. I don't see any rashes, lesions, bruising, abnormal hair patterns, no edema, redness, inflammation, anything like that. He doesn't have any tattoos or piercings. Next, I would look at his nails. So I'm going to inspect his nail beds. There's no clubbing noted, which is a normal finding. I would check cap refill. It's less than 3 seconds, so that is normal as well. The skin around his nails is intact. There's no redness, abrasions. I don't see any kind of swelling or anything like that, so that's normal. So next we'll move on to the HEENT exam. Could you take your hat off for me? Before I do that, I will assess his neurological status briefly just to make sure he's alert oriented. And so can you tell me your name?
Chuck.
Okay, where are we at right now?
The office.
What year is it?
2021.
And what am I doing right now?
Full body assessment.
Okay, so he's alert oriented ×4, which is a normal finding. So we'll start with the HEENT exam. So I'm going to assess his scalp for any lesions. I don't see any bruises. I don't see any bulging, anything like that. The head is normocephalic. Next, I'm going to assess his hair. It is coarse and thick. It's brown. I don't see any parasites, anything like that in the hairline, so that is normal as well. Next, I'm going to look at his face. It appears symmetrical, but we're going to test cranial nerve 7, so I'm going to have you smile, frown. Can you squint your eyes, puff out your cheeks? Okay, cranial nerve 7 is intact. This is the facial nerve. Next, we're going to go to the eyes. So I'm going to get my ophthalmoscope. Before I do this, I forgot to assess cranial nerve 5. So I'm going to have him clench his teeth. I'm going to assess the temporal and masseter muscles. Cranial nerve 5 is intact. I'm also going to assess the sinuses. So the temporal and maxillary sinuses, when I look at them, I don't see any redness or swelling right off the bat. So I'm going to palpate them and percuss. Okay, these are all normal findings. Did you feel any tenderness or pain when I did that assessment?
No.
No. Okay, so that's a normal finding as well. So now we'll move on to the eyes. First, I'm going to inspect his eyebrows, eyelids, and eyelashes, and those all look normal. Next, I'll inspect the external structures of the eye. So just looking at it, his iris looks intact. Pupils are 3 millimeters, which is a normal finding. His cornea appears to be intact. I don't see any hemorrhages. His conjunctiva looks normal, and the lacrimal ducts appear. He doesn't have any excessive dryness or tearing of the eye, so that's a normal finding as well. So next, I will do we'll do the Snellen eye chart to assess cranial nerve 2, which is the optic nerve. So I'm going to have you hold this little chart. It says to hold it about 6 feet from the eyes, and I want you to read the smallest line that you can see.
LT of PH.
Okay, good. So his vision is 20/20. This is normal finding. Cranial nerve 2 is intact. Next, we will use the ophthalmoscope to assess the eye, the internal structures of the eye. So I will do, I'm going to do right eye only for the sake of time. So I will put this on my right eye to assess the patient's right eye. So when I'm looking at it, the macula and fovea centralis are visible. The retinal background appears normal. There's no hemorrhage. The pupil that I can see is normal. The cornea is intact. No redness or abnormalities. There's no foreign bodies in the eye. So everything looks intact from what I can see. Next, we will assess cranial nerves 3, 4, and 6. I'm going to start by doing a corneal exam. I'm going to check the pupils. So I will do corneal light reflex to make sure the pupils are equally round and reactive. I don't have a pen light, so I'm going to use the light on my ophthalmoscope. I want you to look straight ahead for me. I'm going to shine a light in your eye. Okay. All right, so the pupils are equally round and reactive to light and accommodation. This is a normal finding. Normally I would do this in a dimly lit room, but because we can't play with the lights in here, we're just going to pretend that it was dimly lit. Next, I'm going to check his points of gaze. So I want you to look straight ahead, and I want you to follow this ophthalmoscope with your eyes only. Don't move your head, okay? Okay, good. So there was no strabismus or nystagmus, so this is a normal finding. And next I'm going to do the cover test. So I would like for you to cover your right eye and look at my object. Okay, and now swap to the other eye and stay looking at my object. Good, now down. Okay. His eyes did not deviate, and I didn't see any bobbing, nystagmus, strabismus, anything like that, so that's a normal finding as well. So these all test for cranial nerves 3, 4, and 6. Next, we are going to move on to the ears. So I'm going to get my otoscope, and first I'm going to just, I'll come over here and I'm just going to inspect the ear. So the pinna appears when I pull it up and back, which is what you're supposed to do for an adult. I don't see any abnormalities. I do see a small amount of brown cerumen in the external canal of the ear. I'm going to palpate the tragus and the pinna. Did you feel any pain when I did that?
No.
Okay. Next, I'm going to use the otoscope to inspect the internal structures of the ear. Okay, there is a medium amount of brown cerumen present, but this is normal for most people. Let's see. I can visualize the cone of light. The canal is gray and pearly, so that's a normal finding. There's no redness or that I can see, so this is normal as well. Okay. Next, I'm going to assess for hearing. So I'm going to come around here and we're going to do the whisper test. So I'm going to stand behind the patient and whisper something, and I want you to repeat after me.
The cat in the hat.
Okay, so the patient's hearing is normal. Now we're going to assess for cranial nerve 8 by doing the Weber and the Ryan test. So we're going to do the Weber test first. I'm going to strike the tuning fork and put it in front of the patient's head, and I want you to tell me if you can hear the sound equally in both ears or better in one ear or the other, okay? Was that equal? Okay, so the Weber test is normal. Now we're going to do the Ryan test, and this test for air and bone conduction. So air conduction should be twice what bone conduction, or twice the length of bone conduction. So I'm going to strike the tuning fork, put it beside your ear, and you tell me when you stop hearing the sound and I will move it, okay?
Okay.
Okay. All right, so this is a normal finding. Air conduction was twice the length of bone conduction. So cranial nerve 8 is intact. So next we will do the nose. I'm just going to start by inspecting the nose. I'm going to palpate the, everything looks symmetrical, intact. From what I can see, I'm going to look up the nose with the otoscope, and I would change out the cover on this as well. Can you look up for me? Okay, I'm looking inside the nares. The nasal turbinates are pink and moist and intact. I don't see any drainage or exudate. Now we're going to test the patency of the nares. So can you put one finger over your nose and blow? And can you do it to the other side? Okay, good. So the nostrils and the nares are patent. And the bridge of the nose is midline, so this is a normal finding as well. Now we're going to go to the throat and mouth. So I want you to open up for me. I'm going to inspect the teeth. His teeth look normal. I'm going to use a light as well. Can you open up? Buccal mucosa is pink and moist. Dentation is normal. His pharynx is pink, not red, and there's no exudate, which is a normal finding. I'm going to look at his tonsils. They are 2+ in size, which is a normal finding. Can you open up wide and say ah for me?
Ah.
Okay. This checks cranial nerves 9 and 10. I would use the gag reflex to check cranial nerve 10, but I'm not going to gag him for the sake of this exam. Next, I'm going to have him stick out his tongue and move it side to side. Okay, this checks for cranial nerve 12, and it is intact. If I had gloves on, I would palpate the tongue and make sure I didn't feel any abnormal areas or see any dark spots, which I could not see during the exam, so that is also normal as well. So next, I'm going to inspect all of the lymph nodes. We'll move on to the neck. I'm just going to do one side for the sake of this exam, but I will do pre-auricular, post-auricular, occipital, anterior and posterior cervical change, tonsillar, submaxillary, submental, and clavicular. So all his lymph nodes are freely movable, and they're non-tender And did you feel any pain when I did that exam?
No.
So this is a normal finding. Next, I'm just gonna look and inspect his neck. I'm gonna kind of palpate. So his trachea is midline. This is a normal finding. Next, we will inspect the thyroid. So I'm gonna come behind him. And I'm just gonna put my hands and I'm gonna palpate lightly. I don't feel the thyroid. Can you swallow for me? Okay, and swallow again. All right, so this is a normal finding. And next I'm gonna check for cranial nerve 11. I'm gonna test his sternocleidomastoid and masseter muscles. So I'm gonna put my hand on your shoulder. I want you to shrug your shoulder and try to press against. Okay, good. And then I'm gonna put my hand on your face and I want you to turn towards my hand and try to resist my hand. Okay, good. So cranial nerve 11 is intact and he has strong movement in those muscles as well. Okay, we are going to move on to the respiratory and the thoracic part of the exam. So I want you to turn to the side for me, please. And video, if you'll come over here. First, I'm just going to palpate and inspect the spine. Okay, everything looks normal, no bulging, nothing like that. Next, I'm going to check for tactile fremitus for the respiratory exam. So I'm going to place my hands on the patient and I'm going to want you to say 99 every time I go down your back, okay? All right, go.
99, 99, 99, 99, 99.
Okay, so tactile fremitus is normal. Next, I'm going to place my hands at the 10th ribs, and I want you to take a deep breath in for me. Okay, so chest expansion is equal and symmetrical. This is a normal finding. I also want to note that the patient appears to be breathing normally. He's not using accessory muscles. His AP diameter is 2 to 1. He's not barrel chested, and he's not using retractions or anything like that. So that's a normal finding as well. Next, I'm going to percuss. Okay, he had normal resonance. There was no hyperresonance or anything like that, so that's a normal finding as well. Next, I'm going to auscultate his lungs posteriorly. Can you take a deep breath for me? Deep breath. Deep breath. Deep breath. Okay. I did not hear any crackles, wheezing, bronchi. Lungs were clear. This is a normal finding. Next, I'm going to have you move back to the front for me. Okay. I'm going to auscultate his lungs anteriorly. And take a deep breath. Deep breath. Deep breath. Deep breath. Okay, good. All right. I'm going to check for CVA tenderness that I did not just do when we were at the back. So I will have you move just to the side slightly. Did you feel any pain or tenderness when I did that exam?
No.
Okay, that's a normal finding. So the patient does not have CVA tenderness. Next, I'm going to do a breast assessment. For the sake of the patient's modesty, I'm not going to have him take his shirt off, but I would have him move in 2 different positions to examine his breast, so either forward, backwards. He could put his hands behind his back, but I'm going to just go ahead and kind of assess. I'll assess the nipple, the areolar, the pre-areolar areas, the breast, and then the tail of Spence, and they all feel and appear normal at this time. I would also teach the patient how to do a self-breast exam. So by doing that, I would tell you to do this at least once a month, usually at the same time every month. It can be done in the shower. Start by lightly palpating and then deeply palpating your breast tissue and moving in the same motion every time. I usually say either go clockwise or counterclockwise. And you're going to want to do this with your hands by your side, one arm behind your back, or one arm behind your head, and then an arm behind your back as well. Okay? All right. Next, I'm going to do the cardiovascular exam. So I'm going to palpate patient's carotid pulse and temporal pulse. These are both 2+, which is a normal finding. I will also listen. Okay, I didn't hear any bruits or thrills, so that's a normal finding as well. I'm just going to inspect the patient's chest and palpate for thrills or heaves, which I do not feel. This is a normal finding as well. I'm going to locate the, I'm going to have you lay back for this. Okay, I'm going to locate the point of maximal impulse, which is usually at the 5th intercostal space, mid-clavicular line, but I cannot feel it on this patient, which is a normal finding. Next, I will have, I will keep you laying down for this, but I'm going to auscultate for the 5 points. So aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic is the right 2nd intercostal space. Pulmonic is the left 2nd intercostal space. Erb's point is the 3rd intercostal space, left sternal border. Tricuspid is the 4th intercostal space, left sternal border. And then the mitral is 5th intercostal space at the end of the left sternal border or towards the midclavicular line. Okay, so I didn't hear any, I heard S1, S2, no murmurs, bruits, anything like that, so that is a normal finding. For cardiovascular, I'm also going to assess the patient's pulses. So I would assess radial pulse, and it is +2 and normal. Femoral pulses I will not assess for the sake of this exam, but we just know we would. I'm going to do popliteal, +2 and normal, post-tibial, +2 and normal, and dorsalis pedis, +2 and normal. Okay, I think that concludes the cardiac exam, so now we're going to move into abdominal. I'm going to raise the patient's shirt. The order for this is inspect, inspect, auscultate, percuss, and then palpate. So I would inspect first. The stomach appears flat. There's no bulges. I don't see any hernias or anything like that. The umbilicus is normal with no bulging. Then I would auscultate. So I'm going to auscultate each quadrant. And the bowel sounds are normal active, which is a normal finding. I'll also auscultate for the aorta. I don't hear any bruits or thrills, which is a normal finding. And then I also would auscultate the femoral area, but I'm not going to for the sake of this exam. And then I'm going to percuss. So I'm going to percuss each quadrant, and I'm going to percuss, find the liver, and percuss that area as well as the spleen, which is on the left side of the body. And they were both dull, which is a normal finding. Next, I'm going to do light palpation. So I'm going to lightly palpate the liver and the spleen and each quadrant. You feel any tenderness or pain?
No.
Okay, now I'm gonna deeply palpate. Okay, I cannot feel the liver or the spleen, which is normal finding. I'm also going to palpate the right and left kidneys, and I don't feel those, which can be a normal finding as well. So I think that concludes the abdominal exam. You can sit up for me. Okay, next we are going to move on to musculoskeletal. So I've already assessed the neck and the spine, so now we are going to do the arms. So can you hold your arm out for me? Make a fist. I'm going to press down. I want you to try to resist. Okay, try to resist here. When you like this. I want you to move your wrist upwards and side to side. Good. So hit and grip my hand. Good. So grip strength is 5 out of 5 on the arms. I also want you to flex your arm like this, and I'm going to assess for the lymph nodes here as well. They are freely movable and non-tender. I want you to do this and straighten out your arm and move it all the way down. Okay. Next, I'm going to assess for his knees. So I would inspect the knee and palpate. I don't feel anything abnormal. His knee, the skin around the knee appears normal, no lesions, bruising. Can you move your knee up to your chest? Good. Okay, and I want you to move it up, and I'm going to press against it. Okay, good. This is 5 out of 5 grip strength as well. We're going to assess range of motion of your hips, so put your legs straight out. Okay, and I want you to try to raise up your leg and press against my hand. Okay, and I want you to try to move your leg inwards, pressing against my hand. Okay, and outward. Okay, so range of motion of the hip, including abduction and adduction, are 5 out of 5. Next, I want you to flex your foot and extend it and move it side to side. Okay, and I want you to press against my hand. Okay, and I want you to move it backwards and also press against my hand. Okay, so his foot grip strength is 5 out of 5. Next, I want you to stand for me. I'm going to assess his spine. So can you bend over? Okay, his spine feels normal. Touch your toes. Okay, you can stand back up. And I want you to move backwards and forwards and side to side. Okay, so the range of motion of the spine is normal. Can you, next we'll move on into neurological. So can you walk in a straight line for me? Okay, and backwards, or sorry, walk back towards me. Okay, and then I want you to walk heel to toe, just like this. Good. Now can you walk on your tippy toes? Okay, and on your heels. Okay, and I want you to stand with your feet by your side, arms out, and close your eyes. This is the Romberg test, and the patient is not swaying, so this is a normal finding. Next, I want you to look at me, and I want you to put your hand on your finger on your nose, and then to my finger, and then nose to finger, nose to finger. Good. Okay. Neurological exam so far is intact. Next, I'm going to check your reflexes. Okay, so I'm going to check your brachioradialis. Okay, and then your biceps. So I'm going to put my thumb here. Okay, and I want you to hold your arm out. And I'm going to put this right above your elbow to check your triceps reflex. Okay, next I'm going to check your patellar reflex and your Achilles. Okay, so he has +2 reflexes. They are all normal. And I believe that concludes the exam. Thank you for your time, and